There's two orthopedic traumatologists, myself and Jim Mountner. He's also an Army. He's been in practice for 10 or so years. We also have a nurse practitioner and a physician assistant, as well as medical assistants that we work with. We work with a team of nurses, case managers, and physical therapists on the floor. We have a dedicated floor here specifically for the post-operative care, and we work closely with them to facilitate the care of the orthopedic trauma patients.
Okay. And when would you say it's like a step two that you have to go into surgery? Because there's obviously someone can like fall and, you know, break a bone, and it might just be, I mean, I don't know because I'm not a doctor, but it might be something where you can just put a cast and then they go on their way. But when do you know that you actually need to do surgery?
So we always have a discussion about with the patient and the family about their injury and sort of what it entails, and we discuss various types of treatment, mainly non-op versus operative treatment, and we try to make a mutual decision with the patient and their family what is best to pursue for that individual. And every injury is different. Every patient's an individual case, and so we have that discussion every time.
So what would you say is the most common injury you see?
Well, we see a lot of hip fractures and ankle fractures, which parallels the patient population in the U.S. Those are the two most common things that orthopedic surgeons would treat for fracture care. And so that makes up a good deal of our fractures that we treat. We also see complex injuries, tibial plateau fractures, femoral shaft fractures, pelvis and acetabular fractures, and things like non-unions and malunions, where fractures that have been remotely treated or treated elsewhere, or maybe at our facility, have had a hard time healing, and then we help with fixing that problem and getting the patient onto the road to recovery.
So that's interesting. So would you say that not every time you treat a patient, it's necessarily an emergency? It's not like someone got there because they had just fallen. So there are some cases that you do look at that are probably cases that were handled other places.
Correct. So the majority, I would say, are people that come to our emergency department and have a broken ankle, a broken hip, a broken femur, or whatever, and then have either if they can go home with their injury, they can come back for surgery. But a lot of times they are admitted to the hospital and get surgery. For example, down the other spectrum, yesterday I did surgery on someone who had a humeral shaft non-union from non-operative management that occurred 4 months ago. And so they scheduled a surgery day and did the surgery, and they're going to go home today.
So when would somebody, for example, maybe somebody broke their bone a couple of months ago, when should they know to come see you or see a specialist like you?
I would think that if someone has a fractured bone, they should see an orthopedic surgeon. It doesn't necessarily have to be an orthopedic traumatologist. There's two of us that are here, and there's multiple other members of our orthopedic team that are capable of taking care of fractures as well. But I'd say if you have a broken bone, that doesn't include necessarily the face bones, but a broken extremity, then an orthopedic surgeon would be an appropriate consultation to obtain.
Okay. And so I know you mentioned hip bones and ankle bones. Are those the most common bones that are broken, would you say?
They're the most common injuries that require surgery. So just about every hip fracture needs surgery because people don't do very well with a broken hip. Can't really do a whole lot if your hip's broken. Ankle fractures are not always required to be treated operatively, but it's a very common thing to injure.
And what would you say is probably the most common age of patients that you see?
It is definitely a bimodal distribution. So there's young people that have higher energy injuries. They're riding a bike and fall off their bike, or they're in a car accident. They jump from a building, fall from a ladder. And then there's older patients who have more fragile bones, they get osteoporosis, and they have low energy falls, ankle fractures, pelvic fractures. So it's really those two categories of patients.
So I know you mentioned older patients, and I know that, their bones are more fragile. Is there anything that caretakers could do or that older adults can do to to eliminate these falls or, kind of make it easier on themselves?
Yes, absolutely. I'll start off by saying that we have a physician assistant here in our clinic who is in charge of a fragility fracture care clinic. And that might sound confusing, but that is meant to treat osteoporosis. He's an orthopedic trained physician assistant. And after we have a patient typically over the age of 65 or with any type of fragility fracture, set the patient up with Daryl, and they go and see him, get the workup that is needed. And then if they would merit treatment for osteoporosis, osteopenia, he helps coordinate that. If we need extra medical assistance, let's say from primary care or from endocrinology, we have that service available here at Ochsner, and we can refer the patients there for treatment of their osteoporosis. Specifically for that question, for folks that are at home, you have an elderly person that lives with you, things that come to my mind would be making sure that their vision is best it could be, that they have the appropriate glasses, and then making sure that the clear pathway allows to avoid falls. One thing that I tell patients after we do surgery and I see it in the clinic is I say, you have one rule, right? It's to not fall. So don't fall. If that requires you to use a cane, okay, that's fine. Don't fall. If that requires you to use a walker, okay, don't fall. And so make sure that those gait aids are available. There's also home health services or outpatient therapy services that could help to determine what needs are required at home to make home safer.
So we have a question from the audience, and they ask, if I fracture a bone, will my bone ever be the same? What can I expect from recovery?
Oh, that really depends on the injury. That's a good question. And bones do a great job of healing and remodeling. So after you break a bone, it heals, and it kind of has soft, callus, more like putty, and then it gets harder, and it gets kind of thicker, and it gets solid. It always typically looks a little bit different on X-ray, but I would say that if it heals correctly, it's going to be as strong as it was before. Usually if we do surgery, we straighten the bone up pretty well, and it looks, the alignment is very close. Sometimes with non-operative management of fractures, which was much more prevalent in the past, the bone isn't necessarily straight, but it's strong. So I think to answer that question, your bone should be about normal. Depending on your fracture, you could or could not have a deficit in your function.
Well, that's good to know. I know a couple of weeks ago, or not weeks, a couple of months ago, I broke my toe, and I was just like, will it ever be the same? So that's definitely comforting to know.
Yeah, it depends. Sometimes, when you hear anything or break something, it's always a little bit different, but usually people get a reasonable amount of function, but it can vary greatly if you have a severe injury.
So when it comes to children, I know we were talking about older adults. What could parents do to kind of, children are very unpredictable. So I know this is kind of a hard question maybe, but what can parents do to make sure that they're keeping their children as safe as possible from getting a traumatic injury?
Well, I'll say that my sons broke both arms already, and so I cannot prevent that either. Kids are rambunctious, and they're made to do things, and sometimes they get hurt. So I think parents should do normal parenting things, keep a watchful eye, but you can't keep kids from climbing trees and wrestling with their siblings or cousins or whatnot. So healthy diet, and make sure they're not doing anything dangerous like jumping off of buildings. And if they break something,
Well,
we
that's
have
interesting that
orthopedics to fix them.
Well, that's interesting that you mentioned healthy diet. What would you say is a proper healthy diet to have strong bones? You know, before we all heard the got milk commercials and milk makes stronger bones. Is that true?
Yeah, you need calcium to build up your bones, and you need sunlight. So being out in the sun, being healthy and active, and eating a well-balanced diet. Fruits, veggies, milk.
Are there any foods
Less candy.
of fruits, vegetables, less candy?
Yeah.
Well, hopefully some of our younger audience will listen.
Yeah, I'm not sure how many
anything-
kids will be watching.
You never know. They could be hearing in the background. That's my hope. So is there anything a mom could do or a parent can do if their child, falls out of a tree, broke their kid, they think their kid fractured their leg? What should they do before going to the emergency room? Is there any type of prep or, anything that they could do to kind of alleviate the pain? What should they do?
Sure. Yeah. I would try to, if there's something that's hurt, I would try to immobilize that the best you can. Hold your arm near to your body, or wrap the leg with an ACE wrap. Keep the leg or arm steady. Put ice on it. Try not to move it or bend it. And then if you're really concerned about an injury, one thing I would recommend, sometimes surgery is required right away. So I wouldn't eat or drink anything, if you're coming in the hospital because you think the bone's, sticking out or whatnot. But I think it would be ice and try to immobilize it the best you can.
Okay. Do you have any tips for maybe those injuries that are probably like very out of somebody's hands, maybe a car crash or something like that? Do you have any tips for those type of injuries where, you might not always have somebody there to kind of take you to the hospital? You have to wait for the ambulance.
I think you try to stay calm and just do the best that you can with the knowledge that you have. And then listen to EMS and the emergency providers.
So I think you probably have one of the most fascinating jobs, because I feel like you have to be so calm, cool, and collected under a very stressful situation. What would you say is your favorite part of your job?
I think there's two things. The residents, we train residents here, so there's two things that I like. One is when I get to help with a patient who's severely injured and traumatized, and it's sort of like a life-saving effort with the general surgery team and other consultants. And then the other one is after someone is broken with whatever the injury may be, when they're healed and they can walk again or they regain function. I think that's the most rewarding thing.
Awesome. And so I believe that's all the time we have. But before I let you go, I want to ask you one more question. And I want to know, what advice would you give to patients who are experiencing some type of orthopedic trauma?
Well, anytime you have trauma, especially a physical trauma, it can affect you in multiple ways. One is the physical toll and the pain, and so that's a common thing. That for pain, there's medicine that we can give you, temporarily, but to some degree, it's pain that's going to be there and then it's going to get better. But there's also an emotional toll, and that takes a little time and that takes work, and it sometimes helps to talk to other people about that, or to a counselor, friends, family, religious, spiritual people that you talk with, and so that can't be ignored. We can do our job as surgeons to fix the physical part, fix the bones, make them straight. But sometimes after trauma, you need more help from other folks to help you really, truly recover as a person.
Well, thank you so much. That is really great advice because I think so many times we forget that there's different components to an injury. And it's not just always something that's physical, but something mental. Sometimes we take things for granted and we might break our arm and we don't realize how much we use our arm until we don't have that mobility for a short period of time. So that is great advice. Thank you so much, doctor, for being with us here today.
You're welcome. Thanks for having me.
Awesome. And thank you so much to all of our viewers who are watching today. If you have any more questions, please make sure to leave it in the comments below. And for all things orthopedics and sports medicine, please make sure to follow the Ochsner Orthopedics and Sports Medicine Facebook page. I'll see you next time.